Thank you very much and good afternoon. 694 people who are positive or have been diagnosed with COVID-19 here in British Columbia, including 4 who are epidemiologically linked cases, bringing the number of people with COVID-19 in BC to 35,422 people. Of the new cases, 114 people are in the Vancouver Coastal Health Region, 465 people are in the Fraser Health Region, 10 people are on Vancouver Island Health, 82 people are in Interior Health Region, and 23 people are in the Northern Health Region. We are now up to 9,103 active cases across the province in all health authorities, of whom 325 are in hospital currently, 80 of whom are in critical care or ICU. We have 10,849 people under active public health monitoring and 24,928 people who are recovered from COVID-19. Again, today we have 12 new deaths to report, to bring our total number of people who have died from COVID-19 to 481 in the province. And my heartfelt condolences go out again to the families, our care providers, and the communities who lost loved ones, and we mourn with you. We have 3 new healthcare outbreaks to report in British Columbia, one at the Bailey House long-term care home, one at Gateway Lodge, and the University Hospital of Northern BC, both of which are in the Northern Health Authority. We now have 56 active outbreaks in long-term care and assisted living, and 8 in acute care. And that involves 958 residents and 559 staff across the province. We are continuing to make progress, as we talked about earlier this week, on our BC COVID-19 immunization vaccine strategy, Operation Immunize, and we have established now our emergency response or emergency operations coordinating committee to lead the management and very soon, we hope, delivery of vaccines across our province. And today, Dr. Ross Brown, who has been leading the charge on this, along with a number of our key folk from the BC CDC team and others, participated with our provincial and federal counterparts on a remote tabletop exercise to try and walk through all of those key steps that we're going to need to have in place and understand how to facilitate the vaccine delivery and then immunization processes here in the province, and to anticipate any of the challenges or roadblocks that might come up, so we can address them now, as we know that vaccine will be available in the coming weeks. And next week, Dr. Brown and myself and Minister Dix will provide a detailed update to everybody on our plans and where we are and how we are going to move forward here in British Columbia to make sure that people can receive immunization in the most efficient and effective way possible as soon as it is available here in Canada. As you know, our focus with this pandemic has been to understand risks and to take the measures we need to address those risks. And the risks are about where and how and with whom transmission is occurring. And that is what we have been doing, and we've been learning from the very beginning. We look at what is happening here in BC, as well as we look at what happens across Canada, across the US, and around the world, and we learn from what is happening and the measures that people are taking everywhere. And based on this information, we put in the measures that we feel are needed here in British Columbia to best protect everyone in the province. As vaccines become available, they will become our first step to protect people who are most at risk from severe illness and from death, and to protect our healthcare system. We know that we will have limited amounts at first, so we won't be able to broadly achieve what we've been calling community immunity or herd immunity right off the bat, but that will come. Our first priority will be to make sure that we're protecting those who are most at risk, we know that is our seniors and elders in our communities, in long-term care homes in particular, and in hospitals here in British Columbia. And once we have more vaccine available, we will be making it available to all of us in BC. And that is when we can get to that point of managing and controlling this pandemic. But for now, we must all stay strong. Many of our communities around this province are affected right now, many of whom went through the first wave, the first number of months of this pandemic without having cases, without having it touch close to home. And we know that our long-term care homes in particular are most vulnerable, and we know right now it's the biggest challenge that we are facing. And the healthcare workers who are working tirelessly in our hospitals, but in our care homes across the province, are doing their very best to care for people on a daily basis and to try and keep this virus at bay. But we know our hospitals, our long-term care homes, and our healthcare workers are strained and are tired. And we need to do our bit everywhere to make sure that we support and protect them too. And that is the purpose of the orders that we've had in place here in BC, the reason why we need to reduce our social interactions, the reason why we have postponed or suspended or cancelled events, the reason why we put in restrictions on some of the adult team sports that we have had and been able to enjoy in the last little while. What we have seen is that when people come together, this virus can spread, now more than ever, particularly as we go through winter in the province. I do want to say, though, that I recognize that this sacrifice is one that all of us are taking, and the vast majority of people around BC have taken this to heart and are doing their part to protect us all, to protect those we are closest to and those we don't know. And you may feel that you are the only one. It seems like there's lots out there, people who are not taking this seriously. But I know better. I know that we have seen sacrifices from people everywhere in BC, and that you are all part of our team, and that is what is making the difference for us. We need to stay all in, 100% committed to getting us through these next few weeks to months, so that we will have the ability to protect people and to save lives. And through your efforts, we will get through this. We will get through this pandemic together, and we will do it by being kind and being calm and being safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to join Dr. Henry, and I know on behalf of the Premier and all people in BC in passing on condolences to the families, the friends, the caregivers of the 12 people who passed away, 8 in the Fraser Health Authority, 4 in the Vancouver Coastal Health Authority in the last 24 hours. This is, and some of these, of course, a significant proportion, as has been consistent throughout the pandemic, are occurring in long-term care, and we want to pass on our special wishes because we know how difficult a time this is for whole communities of people in long-term care, for everybody who's dealing with an outbreak anywhere in British Columbia in a long-term care home, whether they're residents themselves or families of residents or caregivers, that is a moment of extraordinary stress. And to combine with that the sense of loss and what it means to people, we want to say to people that we're with them, that we're thinking of them, and that every single case matters to us, and I know matters to people across the province. And so any day when you're reporting any death is a difficult day, and today we're reporting 12, and that tells you how difficult a day it is. Wanted to note we have 325 people in hospital, and that's 80 of those in critical care, I believe, 9,103 active cases, 10,843 people under public health surveillance, and what that tells us is how hard people are working in public health. And I want to put this in context with the information about the surgical renewal commitment that's going on during this pandemic in British Columbia. And I just thought I'd start by noting, and you'll know that since May 18th, since we relaunched non-urgent scheduled or sometimes called elective surgeries in BC, 49,100 have been completed in Fraser Health, 32,919 in Interior Health, 10,458 in Northern Health, 42,516 in Vancouver Coastal Health, a remarkable 37,543 in Vancouver Island Health, and 7,266 in the Provincial Health Services Authority. Last week, health authorities reported 6,691 surgeries completed from November 16th to November 22nd. They've now verified their data and the total number of surgeries completed during that week. And you'll all recall the challenges of the week of November 16th to 22nd. The total number of surgeries was, in fact, 7,152, which was 130 more surgeries in this case than the precise number that took place the year previous. And this is in spite of the fact that this week, I should add, from November 23rd to 29th, the preliminary number is 6,736 surgeries, although we would expect that number to rise in a similar way when the full accounting is done. This occurred, of course, during a week where we're reporting that at Lions Gate Hospital, a total of 25 cases were postponed due to the COVID-19 outbreak at that facility. Urgent and emergency surgeries continue at Lions Gate, as well as surgeries that don't require an overnight stay. And obviously, there's been a profound impact, not just by the outbreak, but by the fire at Burnaby Hospital. This week, the surgeries performed at the site decreased by approximately 120 surgeries. But across the system, by the time we gather all the information about this immediate week that we've been in, we'll have done more surgeries this week. By we, I mean the surgeons and the nurses and the healthcare workers and the administration staff that supports it and the health sciences professionals than the same period last year, which gives you a sense of what healthcare workers are doing in addition to dealing with COVID-19 in a week, of course. And in a day, we're reporting 325 COVID-19 patients in hospital, and it goes without saying that is 325 more than last year. I want to note in terms of our capacity, because there's been some questions about acute care capacity in recent days. In terms of our base bed capacity, it's 87.8% of our base beds and 70.6% of our base and surge beds in BC. That's the level of beds that are occupied overall in hospitals. Just to put that in context, last year at this time it was 103.5% of base bed capacity, and that our critical care capacity is running at 76% of our base critical care capacity, but of course we've added critical care capacity and that number is 54.6%. That doesn't mean it's easy and in every case. And what you've heard and what you'll continue to hear is where appropriate, patients are occasionally moved, sometimes from the north to either Vancouver Island or to Metro Vancouver hospitals. That is something that happens all the time in healthcare for a couple of reasons. One, it's very important in some of our regional hospitals, such as Mills Memorial and so on, that we ensure there's adequate ICU capacity in case of other circumstances that occur. For example, potentially, especially this time of year, a major accident on a highway. So at times we move people around, and sometimes because hospitals in Metro Vancouver can provide better treatment for a particular patient. That, what you're seeing, is the public healthcare system working as it should in a pandemic and working as it should every day. But that said, it's very challenging times. It is very challenging times. It has implications, and especially the main implications are for staffing at a time when, of course, a very significant number of healthcare workers themselves have tested positive for COVID-19 in both long-term care and acute care. So our stress is that. The stress on our healthcare workers. It's not about bed capacity, but it is about the extraordinary work done by people in our public healthcare system and by the workers in our public healthcare system. And I want to salute them today, especially on a day when we announce this many new surgeries done in spite of the pandemic. And I just want to say finally, we're entering into this Christmas period, and it is, of course, an important time of year for everybody. It's an important time for all communities. We're also entering into the period of Hanukkah and other holidays and the New Year's and all of the things that happen. And this year, it's simply going to have to be different. And the reason why we need to take action together, in part, is to protect those very healthcare workers who are protecting us. Sometimes that means we've had to cancel events. In fact, we're having to cancel all the events right now. And part of the reason to do that is we don't have to cancel surgeries, and that we can provide better protection for people in long-term care. And I think that empowers all of us to be part of our ongoing effort. I so appreciate what people have done since January. We've been involved in this. We've been briefing on this since January. It's been part of our lives here in British Columbia since then in a profound way. And I so appreciate that today, on December 3rd, that people are still contributing, still making a difference in every community of the province. And we simply have to keep going now. This is the time we have to dig in and follow the health orders, to be 100% all in support of what Dr. Henry and public health is asking us to do, and in some cases by orders telling us to do. We need to do that for the ones that we care for, the ones that we love, and for the ones we don't know. And as we finish as we move forward into another COVID weekend, which with Friday, Saturday, Sunday ahead of us, I think this weekend is especially one where we have to follow those orders. On Monday, Dr. Henry, based on evidence and based on reflection, will be saying what will happen to orders. And at that time, she'll be commenting on that. But in the meantime, it's time to dig in, like I say, and continue to do what British Columbians, I think, have done since the beginning of the pandemic, which is to care for one another, look out for one another, and fight for one another.